Clinical sign of esophagostomiasis or nodular worm diseases in sheep, goat, cattle, that is in ruminants. So in acute condition, there is severe dark green diarrhea or persistent diarrhea, and there will be death of the animal unless removed from the infected pasture. In case of the cattle, there will be dark fatty diarrhea, and according to the literature, 200 to 300 adult worm may cause severe infection in young sheep. Another clinical sign in acute infection includes rapid weight loss, sometimes submandibular edema. And in chronic infection, anorexia, emaciation with intermittent diarrhea, anemia are the clinical signs.